everyone, my name is Taylor Lavoie and I'm an occupational therapy student at the University of North Dakota, and I'm making this video with a couple of my peers also in the OT program at UND. And what we want to do today is just share with you the process of OT and what we do with clients that have various diagnoses. And we also want to share with you different emerging areas of practice and other developed areas of practice. And April is OT month, not sure if you knew that, so that's the purpose of why we're doing this. We want to get the word out there, and we also hope that more people will have an understanding of what OT is, because it's a very unique profession and it can be hard to understand, but it's really amazing. So we want to make sure we're spreading the word and having everyone understand what we do as OTs and all the different areas we can practice in. So we're going to begin by having me be a patient, and I'm going to have what's called a flexor joint contracture. And my OT, her name will be Haley Larson. She is going to evaluate me, treat me, and then see what my outcomes are in regards to if I'm able to engage in occupations. And occupations can be described as anything that's meaningful to you that you do in your daily life. And it honestly is everything that takes up, anything that takes a little bit of time, that's an occupation. So take a journey with us to see the process of OT, followed by a description of all the emerging areas and developed areas of practice as well. Thanks.
I'm going to be evaluating Taylor, my patient, and gathering a little bit of an understanding of her occupational profile and what her injury has started to cause problems for her in her daily life. So, hi Taylor, my name is Haley. I'll be your occupational therapist. So I talked a little bit with the doctor about what had happened to you, and I just want to get a brief understanding of what kind of things that you've had difficulty with in your daily life, if you'd like to explain.
Yeah, well, I'm having a really hard time getting dressed because I can't grasp my clothes to get dressed, and I have to do everything pretty much one-handed or strain my fingers to get my clothes on. And I can't grab my coffee because every time I go to reach for it, I have to use both my hands. And that's really frustrating because I'm right-handed.
Okay, well, you're going to do a little bit of an evaluation to see what areas you're having difficulty with, and then we'll start developing an intervention plan and do some treatment. Dr. Smith said that you were going to have surgery, so we'll probably be seeing you shortly after you're done with your surgery.
Okay.
Okay. So what we're going to do with Taylor is some range of motion exercises to try and increase her range of motion so that she's able to grasp things better. And we also made her a dynamic splint, which will help her increase her functional grasp. So we'll have this on Taylor.
Okay.
And we'll just put this sling onto your finger. And now you have a good extension, so you're able to grasp it better on your cups and anything that you need to.
Okay.
Cool. Okay, so we've been doing therapy with Taylor for 4 weeks now, and so we're gonna see how well she's able to do some of her daily occupations. So Taylor, show me how you use an ATM.
I can actually hold my ATM card.
Nice job.
And I can go back to work. Look at me go. I can grab my coat now. Such a free thumb. Okay, I better grab my coffee because I'm saying sayonara, OT Clinic. Thanks for all you did. I can extend my thumb again and flex it all on my own. Thanks for all you did, Haley.
Now we're going to tell you about some of the specialty areas in occupational therapy. In primary care, the occupational therapist works with clients as the first contact in day-to-day to develop healthy habits and routines to manage their chronic conditions. The OT makes decisions along with the physicians in regards to care with the clients. In the low vision specialty area, the occupational therapist works with clients with a variety of vision discrepancies to rehabilitate the functioning of their eyes in regards to strength, range of motion, accommodation, all the while teaching compensatory strategies. In mental health, OTs can work with a person with a mental health diagnosis anywhere along the continuum from ADHD to schizophrenia in order to manage their mental illness through establishment of coping skills and compensatory strategies. In oncology, occupational therapists assure that all individuals with cancer who are receiving services can enhance their quality of life, utilize energy conservation, and cognitive rehab through retraining their attention and thought processes. In order to address drivers' rehabilitation, occupational therapists ensure that people are able to drive safely and have adaptations necessary to accommodate their disabilities to continue to engage in driving. In the area of productive aging, occupational therapists address age-related discrepancies such as Alzheimer's, low vision, and impaired mobility to help individuals age in place. In the area of burns, occupational therapists address clients' needs to manage scars which form from the burn, wound care, splinting, and address their emotional concerns in regards to their alteration in their physical appearance. In community health and wellness, occupational therapists promote healthy lifestyles for all individuals living in the community independently. Within the school system, OTs make environments that are set up for successful learning in the classroom and address students' needs in regards to physical disabilities and mental health discrepancies. In vestibular rehabilitation, OTs help prevent falls and address one's safety concerns in regards to vestibular processing discrepancies such as vertigo, Meniere's disease, and many more. There are so many more opportunities and specialty areas in the profession of occupational therapy. If you are looking for more information, please look at aota.org. Thanks for listening, and we hope you are in love with OT as much as we are.